Hello, everyone. Good afternoon to you, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky, and as always, we've got a wonderful show for you as we roll throughout this Tuesday. Taking you to the rundown now, we'll show you the guests you can expect on the program today. We are talking about the brain diet with registered dietitian and author Maggie Moon. We've also got Apron Inc. and Osteria Italian Seafood here to preview this month's Chef in a Box. But up first here today, Dr. Kane from Cornerstone Wellness Center back with us to talk all things neuropathy. As we bring you here into the studio, here is Dr. Doug Kane, who you know well by now, and always good to see you.
Thanks for having me back. Always great to be here.
Okay, let's start. It's always good to kind of walk through these things, and I feel like when it comes to neuropathy and some of the things that people suffer with, you can't hear this information too many times because somebody out there maybe has some variation of this, or there's one thing that you say that triggers them to say, I need to do something about this.
Well, neuropathy is the #1 neurological disorder diagnosed in America every day. So every day there's new people that's hearing for the first time, I'm sorry, you've got peripheral neuropathy, and that's usually followed up by the phrase, you're just going to have to learn to live with it. And you know, that is a sentence. And you know, you're sentenced to living the rest of your life in pain with no hope of recovery. It can be managed by masking symptoms with some medications. Gabapentin is usually the first one that's tried, Lyrica, Cymbalta, and so forth. But our message today is I'm board certified in neuropathy and intractable pain, and most people don't realize that even exists. You can reverse neuropathy. That's what we've been doing for almost 8 years in our office, and so that's why we come here to tell people is you don't have to live with this anymore. There is hope for getting your quality of life back and having a better future than what you think might happen.
When you deal with patients who have been told that there was nothing they can do and to just live with it, I mean, we've met several that you brought on the show that said, I was having a hard time living with it. How are you supposed to go forward if you're one of those patients and not do something about this?
Well, the best thing is to be proactive, and I would encourage you to, you know, if you want more information, you know, call the number on your screen right now. My staff is standing by to schedule appointments. If you want to do a little more research, you can look at our website there that's listed on the screen. Scroll down our homepage, and you'll actually see a number of testimonials from various patients, many of them right here on the set of Wave Listens Live. And so they've told their story, and you're going to find somebody's story who matches yours. Most people end up with diabetic neuropathy. That's the #1 cause. Chemotherapy-induced neuropathy. There's a third grouping that I like to call orthopedic-related neuropathy, where there's been some kind of back injury, or there's been surgery like hip replacement, knee replacement, and the nerves have been interfered with to some degree. Those are all things that we can help. Treatment in our office, you know, we start out with a baseline. We test the various types of nerves that are involved in neuropathy, so we get a baseline of how much sensory deprivation a patient has. So that's our baseline, our boilerplate, and we know that we can work back from there. So most of the treatment is done in a person's own home, the convenience of their own home, twice a day. They're likely, you know, they can do it while they're doing something else, where they're sitting on the couch or eating, watching television, or so forth. So the treatment is very unobtrusive. If they require a higher level of treatment, there are things that we can do from the office. Spinal decompression, if there's a spinal component, we can do some gentle chiropractic care if that's something that's needed. The soft wave technology, which we've shown on air here before, has been a game changer for a lot of people. We're getting better results faster with this, but we can work with people for up to 2 years. But generally what we're seeing is them cutting their neuropathy symptoms in half in 90 days. So what that means is by the end of summer, you could have a vastly different quality of life at this point.
You got into this specific type of work for very personal reasons, and someone close to you was told what a lot of people were told, that you got to live with this, and you kind of sat back and said, well, I'm going to see if that's actually the case anymore.
Yeah, I mean, you know, I was taught in school 30-some-odd years ago, just like what's still being taught today, is there's nothing you can be done that can be done for this. And you know, that person close to me was my mother, who I've had on here. She was a 2-time breast cancer survivor, so she had chemotherapy-induced neuropathy, and it occurred to me when she called me years ago that you know, I've been out of school a long time. Maybe things have changed. And so I did some digging, and I found a doctor that actually was reversing neuropathy. He'd been at this point doing it for probably 20, 25 years. So this is really not new. It just takes a long time for this information to filter down. So I actually bought the program that I use with my patients now and used it on my mom and saw the change and realized, you know, you can't unsee something once you know the truth, and we've got to help people in our community with this. And so that's why I took the time and the expense to learn how to do this so that we could help others.
There are always those people out there that say, you know, I'm tough, or maybe mine's not as bad as somebody else's out there, so I don't need to seek treatment. There are other reasons besides just discomfort that is important, that if you are diagnosed with this, it's probably good to at least see if there's something that can be done. I know balance is one you talk about. Yeah,
balance is a big one. So, you know, we all know someone that's older that has fallen, that's had an injury, that's broken a hip or a shoulder. Sometimes there's head injuries involved, and unfortunately sometimes those are fatal. Well, neuropathy, especially in the feet, lead to balance issues that promote these kind of falls. If you don't do anything about it, if you're not proactive, the course of what we see over time is you're going to be on a cane, you're going to be on a walker, you're going to be in a wheelchair. There will be amputations involved. We've had a number of patients come to our office, and on our initial exam, we just stop the exam and say, you need to go to the emergency room, because, you know, maybe they live alone, or, you know, they're older, so the flexibility's not there, so they've got a sore on the bottom of their foot that they can't see, and they don't realize how infected it is. And so we've sent a number of people to the hospital that's resulted in amputations right there. But, you know, they'll come back, you know, once that's healed 6 months down the road, where then we can start treatment so they can save the rest of their toes or foot.
Yeah, and their quality of life as well, get as much of that back as possible. Okay, so for folks out there watching, wondering, okay, how does this process work? What do I do first, and what does a visit to the office look like?
Yeah, so the first thing is it starts with a $49 exam. Like I said, you can call the number on the screen now. My staff is standing by, and they can schedule you likely this week or early next week, so we can get you right in with that. We'll start out with a baseline exam. There's no needles. It's not painful. Our treatment is all natural. There's no drugs, there's no creams, there's no injections. Like I said, you do this in the privacy and comfort of your own home, the lion's share of the treatment. And, you know, we'll do some evaluations along the way and keep tabs on you and make sure you're doing things right and monitor your progress. But yeah, just, you know, today's the first day of the rest of your life, as they say, so pick up the phone and make a change and let us help you.
It's interesting that you're here the day after the NBA Finals wrapped last night. For any of our fans out there that are sports fans, they're high-dollar professional athletes. And you talked about SoftWave is a technology that athletes in the NBA use to treat their own injuries. Again, world-class million-dollar athletes, and you have access to that right there in your office.
Yes, I'm one of the very few people in this region that has one of the new SoftWave machines. It's been used in Germany to some degree for the last 20-plus years. It's only been in the States for a little over 2 years. And it started with who you might think, the research hospitals like Mayo, Johns Hopkins, Harvard, and so forth. But like you said, very quickly bled over into professional sports, because, you know, let's face it, if fans are paying money, good money, to see their favorite player, you want them on the court or on the field or in the game. And so, you know, it's kind of like when Kobe Bryant went to Germany the first time to get PRP. Nobody had ever heard of PRP, and now, you know, there's dozens of people here in town that do that.
Right.
So it's a technology we've been able to bring. It's an acoustic wave technology that eradicates pain. It stimulates blood flow, but the big thing it does is it stimulates your body's own natural stem cells. So your own natural healing, prolonged, so you heal better, stronger, faster. We've got that to start with our neuropathy patients, but we use it a lot for knees and shoulders and other types of things in the body.
We got less than a minute left, but kind of on that topic, if you will, I know that a lot of the patients that come to you are already on maybe over a dozen forms of medication and pills for this, pills for that, and that's why this is so unique and different. You're not telling them, hey, here's more drugs to go take when you get home. You've got other ways that you're able to help and treat this.
Exactly. I mean, think about it. If you accidentally cut yourself with a knife, you heal.
Right.
That healing potential is still there in your body, as long as it's got the proper building blocks to work with. And that's what we do in reversing neuropathy, is we stimulate that blood flow so those cells have the oxygen and nutrients that they need so they can heal. And it really is as simple as that.
You mentioned today is the first day of the rest of your life. We talked about the contact information, got it here on the screen. What's the best way to go about doing this?
Yeah, really just give the office a call. My staff is standing there right now waiting to take your calls and schedule your appointments, and so we can get you onto the road to recovery.
All right. Well, Dr. Kane, it's always good to see you, and thanks for sharing all that information because I know there's a lot of people out there that need to hear it.
Yeah, thanks for having me, Brian. Appreciate it.
All right. Stay with us here on Wave Listens Live. Still two more great segments to go. We're going to talk a bit about brain health coming up next. We'll do that with registered dietitian Maggie Moon. Stay with us.